This is Dr. Ravi Sani. Now today we are going to discuss about the other aspects of salivary gland. The first one is the regulation of salivary gland. So how autonomic nervous system is responsible for regulation of salivary secretion. So basically, uh, salivary glands are supplied by both parasympathetic and sympathetic divisions of autonomic nervous system. Basically, autonomic nervous system two has two divisions, parasympathetic and sympathetic. So these divisions control the secretion of salivary glands. Now going to the function of parasympathetic fibers. So basically, uh, if parasympathetic fibers are stimulated, then they cause a secretion of saliva with large quantity of water. So basically, watery saliva would be secreted if parasympathetic nerve fibers are stimulated, because parasympathetic fibers activate the acinar cells and it dilates blood vessels of salivary gland, which finally results in uh, less organic constituents in saliva. So saliva is watery in nature. If sympathetic fibers are activated, it causes thick and rich in organic constituents. The saliva will be secreted, which is thick in nature and having organic constituents in large amount. So that will be concentrated saliva or thick saliva, because sympathetic fibers activate the acinar cells and causes vasoconstriction. But in this case, the nature of saliva would be concentrated, and in case of parasympathetic, it would be watery saliva. Now come to the parasympathetic nerve supply. This is the parasympathetic nerve supply to the submaxillary or sublingual glands. This superior salivatory nucleus, which is leading to the nervous intermediates of Risberg. Then there is geniculate ganglion, and this one is the facial nerve. And finally, through pre, that is cauda tympani, and through pre-ganglionic fiber, it is containing in lingual nerve, reaching to the post-ganglionic fiber, and finally, from post-ganglionic fiber, there is a nerve fibers containing to the submaxillary gland and sublingual gland. So these post-ganglionic fibers are supplying to the sublingual and submaxillary gland. These post-ganglionic fibers are originating from submaxillary ganglion, which is formed by the lingual nerve. Now come to the here comes a parasympathetic nerve supply of the parotid gland. Inferior salivatory nucleus, there is tympanic branch, tympanic plexus, lesser petrosal nerve here, otic ganglion, and finally post ganglionic fibers are reaching to the parotid gland. Inferior salivatory nucleus, glossopharyngeal nerve, tympanic branch, tympanic plexus, lesser petrosal nerve, otic ganglion, and finally it is reaching to the parotid gland. Now come to the applied physiology, which is related to salivary glands. The first condition is the hyposalivation. So basically, hypersalivation means reduction in secretion of saliva. There is reduction of secretion in saliva. So basically, there is hyposalivation. That means reduction in saliva. Temporary hyposalivation could be result due to emotional conditions like fear, fever, dehydration. These are some conditions which results in hyposalivation. Now, the permanent hyposalivation, it could be due to sialolithiasis, means obstruction of salivary glands. So sialolithiasis means obstruction, obstruction of salivary gland, and the common reason is the stone, that is called sialolithiasis. Another condition is congenital absence or hypoplasia of salivary glands. So salivary glands are absent, or there is underdevelopment of salivary glands, which could result into the permanent hypersalivation. The next condition is the Bell's palsy, that is paralysis of facial nerve. It could also result into the hyposalivation. Now come to the hypersalivation. Hypersalivation means there is excess secretion of saliva. So basically, some physiological conditions like pregnancy, these are normal physiological conditions which could result into the hypersalivation. There are some pathological conditions as well which results in hypersalivation. Hypersalivation means excessive secretion of saliva. The first reason is the abnormal growth or tumor in the mouth due to continuous irritation of nerve endings. There is excessive secretion of saliva. There are some diseases which could occur in esophagus, stomach, or intestine. Neurological disorders like cerebral palsy, cerebral stroke, or Parkinsonism. These are some neurological disorders which results in hypersalivation. Nausea and vomiting are quite common factors, not so much important. In pathological conditions, hypersalivation is called thalassemia, sialuria, sialism, or sialosis. So these are the pathological conditions when hypersalivation occurs. That could be called thalassemia, sialuria, sialism, and sialosis. Some other disorders of salivary glands, xerostomia, that is really, really important. Xerostomia, chorda tympani syndrome, paralytic secretion of saliva, mumps. It is quite common in children. Mainly, parotid gland is involved into that. Parotid gland. The last is Sjogren syndrome. These are some other important disorders related to the salivary glands. Now we are going to deal one by one. The first one is the xerostomia. Basically, xerostomia means dry mouth. It is also called pasties or cotton mouth. The other names are pasties or cotton mouth. Basically, xerostomia, it is due to hyposalivation, or it could be resulta- resultant due to absence of salivary secretion. That is called atylism. Absence of salivary secretion. Either there is either hyposalivation or absence of salivary secretion. That is called tylism, are responsible for xerostomia, pasties, or cotton mouth. The common causes for xerostomia are dehydration, renal failures, Sjogren syndrome, if patient is undergoing uh, in various radiotherapies, uh, trauma to salivary glands or their ducts, common side effects, especially related to various drugs like antihistamines, antidepressants, monoamine oxidase, anti-Parkinsonism drugs, anti-muscarinic drugs. These drugs could also result into xerostomia. Xerostomia basically causes difficulties in mastication, difficulty in swallowing, and difficulty in speech. It could also result into, or it could also responsible for halitosis, that is bad breath. The next disease is chorda tympani syndrome. So this is a condition which is characterized by sweating while eating. If a person is eating, so there is sweating. During trauma or some surgical procedure, some parasympathetic nerve fibers which are connected to salivary glands may be severed or damaged. During regeneration, some of these nerve fibers which run along chorda tympani branch of facial nerve may deviate and join with the nerve fibers supplying sweat glands. So this condition could result into sweating when a subject or person is having food or eating. When the food is placed in the mouth, salivary secretion is associated with sweat secretion. That is chorda tympani syndrome. That is really important. Uh, Sjogren syndrome. It is an autoimmune disorder in which immune cells destroy exocrine glands. The common exocrine glands are related to Sjogren syndrome, lacrimal glands or salivary glands. So there are immune cells which destroys these exocrine glands. The common symptoms of Sjogren syndrome are xerostomia, that is dryness of mouth due to lack of saliva, dryness of mouth due to lack of saliva, persistent cough and dryness of eyes, dryness of skin, nose and vagina, dryness of skin, nose and vagina, persistent cough, dryness or eyes, or lack of saliva, that is xerostomia.